Good morning. Today we will learn about the topic Postnatal Maternal Nursing Assessment. Postnatal Maternal Nursing Assessment is the systematic evaluation of the mother after delivery. Both physical and mental status of the mother we will check in this detail. So the bubble hay is the acronym of postnatal assessment. It is the critical steps in the postnatal assessment. We will see what is bubble hay. In bubble hay, B stands for breast, U stands for uterus, B stands for bowel, B stands for bladder, L stands for lochia, E stands for episiotomy, H stands for Homancine, and E stands for emotional status of the mother. We will see each critical steps in detail. So first B is breast. First and important thing in breast is we should ask the mother whether the mother has initiated breastfeeding or not. Second thing is we should check the breast size, shape and symmetry. And also advise the mother to drink more amount of water. We should also check the nipples of the breast for any crackness or any engorgement. These all are the things we need to assess in breast. Next comes in uterus. In uterus, we palpate the fundus and firmness to prevent the postpartum hemorrhage. After delivery, the uterus will be 13.5 centimeter away from the symphysis pubis. After 24 hours, it decreases by 1 to 1.25 centimeter every day. By the end of second week, the uterus will be in the pelvic organ. Then next we need to assess is bladder. So we should check the patient is emptying her bladder properly or assess for any urinary infections, retention of urine, and also advise the mother to drink more amount of water, at least 8 glasses of water per day, and advise her to empty the bladder regularly. Then next B is bowel. The bowel assessment is very important part in postnatal nursing assessment. So because of this delivery and perineal pain and trauma, there is decreased gastric motility, decreased physical activity and loss of fluid from the body, and dehydration will occur. And also due to the effect of this constipation and pregnancy, there is chances of hemorrhoid also. So advise the mother to drink more amount of water, and also advise the mother to take sitz bath and early ambulation, and also the mother to walk progressively. The next thing, we should assess the peristaltic movement of the mother and also the first bowel movement. This is very important in bowel assessment. The next thing is L, that is lochia. Lochia is the vaginal discharge after delivery. Depends upon the color, amount. There are 3 types of lochia. Lochia rubra, lochia serosa and lochia alba. During this lochial period, we should assess the color, amount and its other characteristic features like odor. So if there is any change in these characteristics, that is suggestive of puerperal infection. The next is E, that is episiotomy. Episiotomy is nothing but the planned surgical incision on the perineum and the posterior vaginal wall to facilitate the childbirth. In episiotomy, postnatally we should assess RIDA. R is redness, E is edema, E is ecchymosis, D is discharge, and A is approximation of wound. Also, we need to assess for pain after delivery. The next is H, that is Homan sign. This sign, positive Homan sign, suggestive of deep vein thrombosis. So, how to perform this test? Advise the mother to be lie in the bed and extend the legs or slightly flex it. A healthcare provider will dorsiflex the ankle of the foot. That time the patient will feel the pain on the calf muscles. That indicate positive signs of deep vein thrombosis. If the mother is having this deep vein thrombosis, advise the patient to early and progressive ambulation. This will improve the circulation. The next is E. E is the emotional status of the mother. It is very important to check the mother's emotional status after delivery because there is increased level of hormones in mother's body, increases the stress level, and also the estrogen level will increase, and there is increased responsibility too. This will because of this there is fluctuation in the emotional status of the mother. So postnatally we need to assess the mother's emotional status. In this postnatal assessment, we usually use a three-phase assessment, that is taking in phase, taking hold phase, and letting go phase. In taking in phase, it is first 24 to 48 hours after birth. So in this, the person is living in that present condition. The mother is focusing on personal health and also the physical comfort, and mother is completely dependent on other family member and also the nurse, and the patient is completely talking about the birth experiences. Next phase is taking hold phase. This phase is several weeks after this delivery, and in this phase the mother will feel little bit independent, get confidence, and the focus is shifting to the infant. The next phase is the letting go phase. In letting go phase, the mother takes the responsibility of her infant and take care of all the things of the infant, independent, completely independent, and decision making skill will increase. So this is about the bubble hair steps in postnatal assessment.